Let's take a look at the early therapeutic process that I go through. This is a conceptual map from the very introduction when you meet the client until you begin to develop a treatment plan. This usually would involve for me about the first session, the second session, and maybe even going into the third session. But for sure, the first and second session is involved here. Now, I'm also going to write down where motivational interviewing and solution-focused techniques come into play and where the processes come into play. That way you can get an idea of where the skills are applied throughout. So let me begin. In the intro, that for motivational interviewing would be called the engage or engagement phase. This is where you're really building the rapport, the relationship of trust, developing an alliance, and really looking for and letting the client know that you're here for them. And this is going to be a collaborative team process. That usually lasts through the biopsychosocial intake. You'll want to be very engaging. Once you hit the goal exploration phase, this then for me is late into the first session or the beginning of the second session. In motivational interviewing, this is really where the focus stage of the MI process is. This is where you're really discussing with the client to come up with a priority list or begin to prioritize what they feel are the topics and issues that are most impacting them. You're starting to get an idea where they're at in the process of change as well as they begin to really develop or hopefully give the clinician some insight as to the topics that are impacting their life and that they're having difficulty with. This focusing stage then, once you get, for me, the top 3, for example, priorities or issues that they want to focus on, this then will help lead you through the rest of the process. I find it very beneficial to come up with a list. That lets the client know what they want to talk about and helps them clarify what brought them into counseling. That helps you as a clinician know what topics even to explore as you go through counseling. That way you're not just wandering around or just randomly picking issues that you feel are important or that the client's just kind of pulling out of the air. It helps to really conceptualize and get a list together of what the primary issues are. From there, both you and the client then will circle or will go up to the topic 1 area up in that right corner where you will begin to explore some of the symptoms. These will be explored in ways of trying to find out what the onset is. Was it an acute problem just recently starting? Is it something that's been chronic or been around for quite some time? The frequency is how often those symptoms occur and how often they experience them. That could be a given week, a given month, a given year. The duration is how long those symptoms last. Do they last over a period of a day, several hours, weeks at a time, months at a time? That's the duration of the symptoms. And then the severity, is it mild, moderate, or severe? Once you get that to the symptomology, this is when things change and where modalities really then come into play. Those early descriptions of the symptomology really are for diagnostic development. The rest of the impact on life, the exploration of change, those number 2 and 3 in that first bubble up there to the right, that's when modalities come into play. And let's take a look. When exploring with a client how change has occurred, for example, asking the client, how has your behavior or functioning changed, and have them begin to describe that using motivational interviewing and solution-focused skills. All of this area over here in blue that I'm outlining, that really is where motivational interviewing and solution-focused therapy come into play. These skills here, in motivational interviewing, we call it eliciting or evoking. This is where you're really looking at the details. So eliciting comes in when you're looking at the details of what they want to change, what exactly does that look like and mean. Evoking is when we're looking at them really diving deep into what's important to them, what their goals are, values are, what their motivators are. That's the MI process, is all of that to find out what they want to change, how they want to change it, why they want to change, and when they want to change. All of that comes into play. Solution focused similarly comes in when you are looking at the details as well during all of this goal setting and exploring how their behavior has changed. You're really looking for the details using the miracle question. You're looking at kind of goal setting, formulation. You're looking for exceptions. You're looking for coping skills. Exploring all of those areas as well under this. So I'm going to outline that in red as well, just to kind of emphasize that that is where all of those skills come into play. Then you're going to repeat that. After you get done with topic number 1, you've explored all of the goals, the details, the values. In solution focused, you're looking for the details, the miracle question, the goals, exception, coping skills. You're also using scaling questions as well in motivational interviewing. You're getting into some of, in addition to the motivators, you may begin to start to scale some of the ruler questions with regard to importance, confidence, and commitment to change, some of those areas. That's all of topic 1. What I do then is I'll go back and then lead to topic 2, for example, in this case, anxiety, and I'll repeat that entire process that I just did for topic 1 using all of the MI skills, all of the solution focus skills, to then explore how anxiety impacts them, what they've tried, what's important to them, what they believe changes with regard to anxiety, and on and on. You'll go back to topic number 3, you'll return to that. You'll repeat that entire process using all of the same MI solution focus skills, and away you go. This then, once you get done with topic 3, you'll move over here then to the planning stage. Now the planning stage for MI and for solution focused is beginning to see what they're willing to do. Now, this depends on the type of client that you have in front of you. In solution-focused therapy, we would call them the visitor, complainant, or customer. If they're the visitor and complainant, as you've learned, we're really going to have them just merely notice or experiment. So in solution-focused therapy, if they're visitors or complainants, we're going to have them just notice or be aware during the week to see if anything changed. We're not going to assign them any particular homework, nor are we really going to plan anything with steps that they need to take during that next week. We're just having them say, hey, during the next week, our focus really is going to be to have you come back. I really want to explore these areas more and get to know you better and see what change even might look like, or if you're even considering change at all. That's really the purpose, is to get visitors and complainants back in to just build that relationship of trust and continue to explore what might be important to them. Now, if you have a customer with solution-focused therapy, you're really going to have the customer then, if that's the case, have them begin to plan which of those things they came up with way back in the details section. So way back here when we were exploring their goals, you're going to ask them, of those things that you mentioned, what are some of the things that you feel comfortable with that you could see yourself doing this next week, realistically? So you're going to have them draw from the planning and have the client develop their own steps and their own vision based on what they came up with, and can see themselves changing in a small way during the next week. So in solution focused, you're going to draw back from all of these earlier processes and ask them which of the things that they feel that they're willing to do during this next week and can see themselves beginning to try. In motivational interviewing, the process of planning actually starts way back in the earlier processes of exploring the topic. However, once you get to the planning stage, that you've explored all the topics, that's when you really do circle back to the darn cats acronym as you are exploring with the client their desire to change, their ability to change, the reasons to change, the need to change. This is when you would use the ruler to look at the importance level, the confidence and commitment level. After you've explored the darn portion, possibly you're seeing that the client's willing to maybe do some steps or they're considering some steps. The cats portion is when you begin to implement the change. So the darn portion is you're examining their readiness and where they're at. The cats portion is when the client's saying, well, you know what, I am willing to consider to begin to do something. You'll then explore the commitment portion of the cats, the activation portion, which is the beginning steps that they're willing to take. And then the T and the S portion, the taking steps, is looking at what exactly are the steps that they're willing to take and what has been taken when you do circle back and review what they've done the next week. Once you've come up with the taking steps portion and you now see that they're ready to change, in MI, you then would move to developing an actual change plan. And this is similar then to a treatment plan that you would develop with any other diagnosis. Specific to MI, their change plan, they lay out exactly kind of the steps and the elements that they recommend, such as outlining specifically what the goal is, in very smart terms. So you're looking at, simple, measurable, attainable, realistic, in a timely manner. Then you're looking for reasons to change, possible barriers, strengths, next steps, support persons, and really then looking at how you're going to evaluate it. How do you know if it's working and what would you do if it wasn't working? That's all part of the MI change plan process. And that might take sessions 3, 4. It really depends on when the client is ready to commit to some level of change or if they're willing to begin to take some steps. So the change plan could drift easily into later sessions, possibly 3, 4, etc. Once you've accomplished or outlined the change plan for MI and in solution focused, maybe they are ready as a customer or even a complainant to experiment with some things. That's when in the later sessions, I would say around session, probably moving on to sessions 3 and later, once you've developed this treatment plan, and that usually comes after about session, session 2 or later, sessions 3 and beyond is more of a circular pattern then of coming back to your treatment plan each session and circling back and looking at what are the goals, what are the objectives, what are the interventions going on, and what's the progress being made. And when using MI or solution focused, you circle back to the questionings that's in each of those modalities, such as what is going better and having them explain even some of the small changes. In motivational interviewing, you're becoming much more curious as to the reasons for change, what motivated them to do that, what are some of the values maybe they tapped into, looking maybe at some of the barriers and breaking down further ambivalence as to why maybe the progression is slowing or stopping or even speeding up. So it's a re-examining of the goals, the objectives, and interventions from there on out using those similar skills. If necessary, you would go back to each of the topics, explore them once again, clarify some of the goals using solution-focused questioning, Maybe their description of the goal has changed or they want to adapt it. In motivational interviewing, you might elicit further details, look at other values or motivators, and go back to each of the topics. Reevaluate with the client. There's nothing wrong with re-examining the reasons that brought them in and checking in with the client to see how progression is being made in each of those areas. Now, if clinicians choose to use other modalities, usually after sessions 2 and 3, once you've explored their goals, desires to change using solution-focused therapy or motivational interviewing, this is when other modalities really start to pick up the pace as clinicians, if they choose to use, for example, CBT, DBT, ACT, EMDR, other modalities. After about session 2, 3, and beyond, other modalities then help provide skills and go much more in depth in the areas that the clinician feels that skill sets can be useful to clients regarding perhaps thoughts, feelings, emotions, behaviors, traumas, memories, things like that. That doesn't mean that MI skills and solution focused are then thrown out the window. In fact, maintaining those skills and using those solution focused questions and motivational interviewing questions help to accent and enhance the other modalities. This has been an overview of the therapeutic process according to Dr. Nate. Thanks.